This lotion is used to moisturize and treat dry, rough, scaly, itchy skin, as well as minor skin irritations like diaper rash and skin burns from radiation therapy. It contains substances that soften and moisturize the skin, reducing itching and flaking. Some of the ingredients are mainly used to protect the skin against irritation, such as from wetness. Dry skin is caused by a loss of water in the top layer of the skin. This lotion works by forming an oily layer on the top of the skin that traps water in the skin. It also contains ingredients that draw water into the outer layer of the skin. Additionally, it has components that soften the substance that holds the top layer of skin cells together, helping the dead skin cells fall off, keeping the skin hydrated, and leaving it feeling smoother and softer. It is recommended to use as needed to keep the skin moisturized and protected. Make sure to follow the directions on the product package before using Aveeno 1.3% Lotion Skin Protectants. Some products may need to be shaken well before use, so be sure to check the label. Apply the lotion to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on your skin condition and the product. For example, if you have dry hands, you may need to apply the lotion every time you wash your hands. If you're using this product for diaper rash, make sure to clean the area well before applying the lotion. And if you're using it for radiation skin burns, check with radiation personnel before applying it. Be sure to only apply the lotion to the skin and avoid sensitive areas like the eyes, mouth, nose, and vaginal/groin area unless directed by your doctor. It's best to apply the lotion to damp skin after bathing or showering, and for very dry skin, your doctor may suggest soaking the area before use. If your condition doesn't improve or gets worse, seek medical help. When using Aveeno 1.3% Lotion Skin Protectants, you may experience some mild side effects such as burning, stinging, redness, or irritation. If these effects persist or worsen, it's important to notify your doctor or pharmacist. If your doctor has prescribed this medication, it means they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. However, it's important to seek medical attention if you notice unusual changes in your skin, signs of skin infection, or any symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist for further guidance. As always, it's recommended to consult with your healthcare provider before starting any new medication. And if you have any concerns or experience any side effects, don't hesitate to reach out to your doctor for medical advice. Before using this lotion, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. If you have any skin cuts, infections, or sores, it's important to consult with your doctor or pharmacist before using this product. Certain ingredients in this lotion, such as preservatives and fragrance, may make your skin more sensitive to the sun. Be sure to check the label for any warnings and ask your doctor or pharmacist if you need to take any special precautions when going out in the sun. Your doctor or pharmacist may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing. If you experience sunburn or skin blisters/redness, make sure to inform your doctor right away. If you have acne-prone skin, be sure to look for the word non-comedogenic on the label to ensure that the lotion will not clog your pores. Additionally, some products may cause staining or discoloration on clothing, so it's best to consult with your doctor or pharmacist for more information. Before undergoing any surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, be sure to inform your doctor before using this lotion. It is also important to consult with your doctor before using this product if you are breastfeeding, especially if you are applying the lotion to the breast area. It's important to be aware of potential drug interactions with Aveeno 1.3% Lotion Skin Protectants. This can affect how your medications work and increase the risk of serious side effects. Be sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. It's essential to consult with your doctor before starting, stopping, or changing the dosage of any medicines. When using Aveeno 1.3% lotion skin protectants, it's important to consider the benefits it provides. This lotion acts as a skin protectant and helps to soothe and hydrate the skin, making it an ideal choice for individuals with dry or sensitive skin. The recommended daily dosage will vary depending on the individual's needs, so it's best to follow the instructions provided by your healthcare professional. As for the optimal timing, it's typically recommended to apply the lotion as needed, especially after bathing or showering when the skin is most receptive to hydration. If this lotion is swallowed, it can be harmful. If someone has taken too much and has severe symptoms like fainting or difficulty breathing, you should call 911. Otherwise, contact a poison control center immediately. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. To prevent dry skin, it's important to use lukewarm water when bathing, and to bathe less frequently. Keeping baths or showers short and using a humidifier in dry air can also help. There are different types of emollient products, such as oils, creams, lotions, or sprays, and some may contain fragrance or other ingredients that could cause sensitivity. It's best to consult with your doctor or pharmacist to find the right product for you. If you forget to use Aveeno 1.3% lotion skin protectants on your regular schedule, use it as soon as you remember. Do not use more product or use it more often than directed to catch up. It's important to stick to the recommended dosage and frequency of use. Be sure to check the storage information on the package and keep all medications out of reach of children and pets. Do not store the Aveeno 1.3% lotion skin protectant near high heat or open flame, and do not puncture or burn the canister. When it is expired or no longer needed, be sure to properly discard the product. If you have any questions about storage, ask your pharmacist for more information. Remember to consult your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.